Hello my dear friends, welcome back. Now we are moving towards one of the most important part in head and neck, which most of the students find it like very difficult, that is cranial nerves part, guys. And believe me, I'm going to make it very easy, and you have to first of all listen to the videos which we have completed prior to this one. I mean to say, to learn about the cranial nerves, you should know first of all about the cavernous sinus, which we have discussed in detail about the dural venous sinuses topic. Then we have to also know about the cranial foramens, which we have discussed in the very beginning of the head and neck topic, guys. Now, once you have learned or once you have gone through those videos, those topics, then it will be a little bit easier for you to understand the entire course of the cranial nerve as well as their supply and everything, guys. So, I want you all to just first of all go through the cavernous sinus topic as well as the cranial foramens topic. Then we can go ahead with the cranial nerve. So now, hoping you have gone through that one, let's continue with the cranial nerves right now. The diagram that you are able to see on the screen here, it's looking like a little bit complicated. In the diagram, we are able to see cranial nerve number 3, oculomotor nerve, the cranial nerve number 4, that is trochlear nerve, and cranial nerve number 6, that is your abducens nerve. So 3, 4 and 6, these 3 nerves will be doing it together first. Why like this? Why? Because we all know they are the one which are going to supply to your extraocular muscles. I hope you know that very famous formula. Throughout the world, every medical student will know that. That is SO4, LR6 and rest all by 3. So, all your extraocular muscles are supplied with these 3 nerves. That's the reason I'm planning to do these 3 nerves first of all, guys. So, don't get panicked by looking at this diagram here. Don't worry, guys. We'll draw our own diagram here and make the things easier. Now, before beginning with the oculomotor nerve, that is your third nerve, I want you all to recall one thing in your mind and very important MCQ in your mind. Third and fourth nerve, we have studied in the neuroanatomy also. They are going to originate from your brain stem, to be more specific from the midbrain part. Okay. So, here try to recall from neuroanatomy. We have already drawn this diagram a lot of times. This is the pons here, followed by this one will be the medulla oblongata here, and this here will be the midbrain. So, midbrain pons and the medulla oblongata, that is your brain stem. I hope you are able to recall. Now, recall one more topic from neuroanatomy that we have learned, that is circle of Willis. And in the formation of circle of Willis, I said you there will be a vertebral artery here from one side and there will be a vertebral artery from the other side. Now, these two will combine together to form basilar artery, guys. Basilar artery which is lying exactly on the pons. Then basilar artery is going to end by dividing into the posterior cerebral artery here. That's your PCA, posterior cerebral artery. And not only posterior cerebral artery, basilar artery will also give a branch to cerebellum behind, and that from above, that is superior cerebellar artery. So, this one here will be the superior cerebellar artery, guys. So, posterior cerebral artery as well as the superior cerebellar artery, both of them are the branches of your basilar artery only, and we have discussed all this in detail in neuroanatomy. Now, what is the point that I want you all to recall in your mind before going ahead with the cranial nerve itself? Third and fourth cranial nerve, these two cranial nerves are going to originate from the midbrain. Third and fourth nerve will be originating from where? From the midbrain. And I hope you also remember that third nerve will be having ventral origin. It will be originating in the front of the midbrain only. Imagine that is your third nerve over there. And we also know that that fossa in the middle is nothing but the interpeduncular fossa. So, third nerve is a content of interpeduncular fossa. Now, the fourth nerve, something peculiar regarding this one, it is the only cranial nerve having dorsal origin, and it is originating from dorsal aspect of the midbrain and then taking a turn and coming in the front. And while taking a turn and coming in the front, again it is going to come from here, sir. So, this is your third cranial nerve, oculomotor nerve, and this one is the fourth cranial nerve, that is your trochlear nerve, coming from behind. Now, the first point in the cranial nerves topic I want you all to understand is that both of your nerves, that is your third nerve as well as fourth nerve, will exit out between posterior cerebral artery and superior cerebellar artery, guys. That's the most important thing, already has been tested in your exam. That is the reason why the students will find it like difficult to study cranial nerves. Why? Because cranial nerves, it's like combination of many topics. You have to recall like neuroanatomy, the brain stem, the circle of Willis, everything has to be imagined at one place, then only you'll be able to answer like MCQs here. So, the first point that we're learning, third and fourth cranial nerve are going to originate from the midbrain. Second point, third nerve has got ventral origin and the fourth nerve has got dorsal origin. And the third most important point is that both the nerves are exiting out, they are coming out between those two arteries. Which two arteries? The posterior cerebral artery and superior cerebellar artery. I hope the concept is crystal clear. Now, keeping this in mind, let us do one thing. First, let's learn about the third cranial nerve, that is your oculomotor nerve, and then the fourth cranial nerve, that is your trochlear nerve. Okay. So, let's get started with the third nerve first of all, guys. So, the third cranial nerve, that is oculomotor nerve. Oculomotor nerve, guys. We'll do one thing. First of all, we'll make the platform ready. Like, what do I mean? First of all, let me draw all those structures from where the third nerve is going to pass. Right from the very beginning, guys, the origin. We all know third nerve is going to originate from where? From the midbrain. So, let me draw a transverse section of the midbrain over here. So, this is how the transverse section of midbrain looks like. Again, the same thing I would like to say, guys. We have studied this in detail in neuroanatomy. And this is the grey matter that you are able to see there, that is substantia nigra. In the center, there will be aqueduct of Sylvius with a little bit of grey matter surrounding that one. That is the transverse section of midbrain. Now, recall one very important point, that third and fourth nerve are originating from midbrain only, but at different levels. The third nerve will be originating at the level of superior colliculus, and fourth nerve will be originating at the level of inferior colliculus. So, when you see on the dorsal side here, this is the colliculus, superior colliculus and superior colliculus. Fine. So, basically we are taking the transverse section of midbrain, but at the level of superior colliculus, guys. Hope you will be able to write it like full form. Transverse section of midbrain at the level of superior colliculus. Perfect. Now, after coming out, exiting out from the midbrain, what is going to happen? After exiting out of the midbrain, coming out of the midbrain, the third nerve is actually going to pass through the cavernous sinus. Is it like exactly passing inside the cavernous sinus? No. It is actually passing through the lateral wall of the cavernous sinus. So, imagine this one here to be the cavernous sinus, and this will be actually the lateral wall of the cavernous sinus, guys. And we have discussed in our previous topics, that is your cavernous sinus topic, that lateral wall, it allows three nerves to pass through that one, the third nerve, the fourth nerve and the ophthalmic nerve, which is a branch of trigeminal, in fact 5-1. That is the reason why I said you in the very beginning that you have to complete those topics first and learn this, then the cranial nerves will become like easy, guys. Is it okay? So, please try to learn these things. Now, after passing through the lateral wall of the cavernous sinus, now the third nerve is going to enter into the orbit. And how it is going to enter into the orbit, guys? Via the superior orbital fissure. So, imagine this one here to be the superior orbital fissure. Superior orbital fissure. Now, after entering inside the orbit, yes, we all know there will be eyeball, and this eyeball is surrounded by extraocular muscles. Extraocular muscles, guys. And the nerve supplied to the extraocular muscle, every medical student knows that with a very famous formula, that is SO4, LR6 and rest all by 3. SO4, LR6 and rest all by the third cranial nerve, that is oculomotor nerve. Fine. So, if you want, you can just write down that formula nearby so that you will be able to recall very quickly while doing the revision. So, SO4, superior oblique is supplied by fourth nerve, LR6, lateral rectus is supplied by the sixth nerve, and the rest all extraocular muscles are supplied by third nerve. Now, guys, one thing I want you to recall in your mind, like how many extraocular muscles are there? Like most of the time in the live classes, when I'm asking these questions to the student, they are like, there are only 6 extraocular muscles. Why? Because always in their mind, they'll be having 4 recti, superior rectus, inferior rectus, medial rectus and lateral rectus, and 2 obliques, superior oblique and inferior oblique, that's all. But they will always forget one LPS, levator palpebrae superioris. So, keep in mind from today onwards, there are totally 7 extraocular muscles. How many? 7. 4 recti, 2 oblique and 1 levator palpebrae superioris. Hope there is no confusion in that. Now, we will draw only those extraocular muscles which will be supplied by the third nerve over here, guys. Okay. So, imagine this one is your superior rectus here, and then here this is the medial rectus here, and this one will be the inferior rectus here. So, there will be a superior rectus, medial rectus and inferior rectus supplied by third nerve. Lateral rectus is taken care by the sixth nerve, that is why I am not drawing in this diagram here. And you all know very well recti are the one which will be inserted onto the sclera, that is why I am drawing over there, guys, attached to the sclera part. Then the third nerve will also supply to oblique and of course it will be supplying to the inferior oblique muscle. So I am just drawing here inferior oblique. You just try to understand, okay, this is the inferior oblique here. Superior oblique will be taken care by the fourth cranial nerve, that is your trochlear nerve. Anything else left out? Yes, one more which is left out here is levator palpebrae superioris. So imagine this one here to be your LPS, for elevating the upper eyelid, guys, palpebrae eyelid. So levator palpebrae superioris, LPS. Now that is what I call it as, like, our platform ready. We got an idea exactly. The third nerve is going to travel from where, the entire course of that, and then finally it will be supplying to which muscles. And now let's get started with our third nerve. The platform is ready, and let's see how the third nerve is actually traveling. Third nerve is going to begin from the midbrain, and one important thing that you have to note down here is that the third nerve nucleus will be actually merged on either side. It's not like separate nucleus on either side. Oculomotor nerve nucleus will not be like a separate nucleus on both the sides. It's actually merged on both the sides. Later on, I'll tell you the importance of that one. There is a very important clinical aspect regarding that one. Okay, so I'll tell you about that. Don't worry. Now from here, the third nerve will exit out, and we all know the third nerve will have a ventral origin. Okay, it will be coming out ventrally in front of the midbrain, and after coming out ventrally, the third nerve is going to pass through the lateral wall of the cavernous sinus. And now starts something important here. Before entering into the superior orbital fissure, I want you to listen with all your ears open now. It divides before entering into the superior orbital fissure, okay, into two divisions. One will be the superior division here, and another one will be the inferior division here, guys. So mark my words, third nerve, oculomotor nerve itself is not entering into the superior orbital fissure. It's dividing just before entering into the superior orbital fissure. Now what is the name of this one, guys? This is nothing but the superior division. I'm just writing as SD here, and this one is the inferior division. Upper division or the lower division, in some books it is given like that, whatever. Superior division and the inferior division, guys. Now after that, now look here, guys, our diagram, it makes it so easier. Okay, superior division will be supplying to which muscles and inferior division will be supplying to which muscles. Superior division will be actually taking care of the two muscles which are present above here. One is LPS, another one is the superior rectus here. Lovely. Okay, so let me do one thing here. Let me just highlight this with the same color. Superior division will take care about the levator palpebrae superioris and superior rectus muscle, the two muscles present above. And inferior division is the one which will be supplying to the remaining muscles, that is your medial rectus, as well as the inferior rectus, as well as the inferior oblique muscle, guys, And let me just highlight this with another color here. So inferior division will take care of medial rectus, inferior rectus, and inferior oblique muscle here. Wow. That's why I'm telling you guys, image based conceptual anatomy. This is the best way to learn. Otherwise, if the same thing, if you just write it like a paragraph and try to mug up, it is passing through lateral wall of cavernous sinus, superior orbital fissure, dividing into two divisions, supplying to which muscle, you don't get an idea. Just the moment you draw this diagram, it makes very clear. No need to mug up at all. Okay. So I repeat again for the last time, superior division will be supplying to levator palpebrae superioris muscle as well as superior rectus. Inferior division will be supplying to the medial rectus, the inferior rectus, as well as the inferior oblique, guys. That makes it very much easier regarding the third nerve. Perfectly done. Now apart from that, one more thing which I want to teach you here itself is that third nerve, it's also having a parasympathetic component, guys. Try to recall from autonomic nervous system, sympathetic and parasympathetic. Parasympathetic nervous system is actually craniosacral outflow. And out of all your 12 pairs of cranial nerves, which cranial nerves will contribute for parasympathetic nervous system? 3, 7, 9, 10. I hope you all remember that from our school days. Parasympathetic nervous system is contributed or formed by 3, 7, 9, 10 cranial nerves. And we are speaking about the third nerve. Okay. So now, what will be the parasympathetic component here? In the same midbrain, you will be able to find that you will be having the Edinger-Westphal nucleus here, sir. There will be one more nucleus present here in the midbrain, that is Edinger-Westphal nucleus. Now this Edinger-Westphal nucleus, the fibers of this will be traveling along with the third nerve only. So even from here, the fibers are actually going to traverse along with the third nerve only, oculomotor nerve. And now something important which has been already tested in your exam. Now these fibers which are coming from Edinger-Westphal nucleus, will they go along with the superior division or the inferior division? That's important. So remember, these fibers are going along with the inferior division. And in fact, the thing which was asked in the exam, are they going along with the nerve to medial rectus, nerve to inferior rectus, or nerve to inferior oblique? So remember, these fibers are going along with nerve to inferior oblique. Then they will be separating apart from here. So I repeat again, you have to make a note of this one, guys. The Edinger-Westphal nucleus, whatever fibers are coming there, they are going along with the inferior division of the third nerve, and not only the inferior division, they are going along with the nerve to inferior oblique. The nerve which is going to inferior oblique, that's the one which is carrying the fibers of Edinger-Westphal nucleus, already has been asked in the exam. Now later on, what is going to happen? Now these fibers will actually go and end in a ganglion. These fibers will go and end in a ganglion, and this ganglion is referred to as your ciliary ganglion. Ciliary ganglion. So the fibers coming from Edinger-Westphal nucleus are ending in the ciliary ganglion. Now from the ciliary ganglion, another fibers are going to begin, and those fibers are referred to as the short ciliary nerve. And those short ciliary nerve will be supplying to ciliaris muscle and the sphincter pupillae muscle, guys. The ciliaris muscle and the sphincter pupillae muscle. I hope you are able to recall sphincter pupillae muscle, when they contract, the contraction of the sphincter pupillae muscle will lead to meiosis, that is constriction of the pupil, nothing but the function of parasympathetic nervous system. And ciliaris muscle, they are actually concerned with your accommodation reflex, guys. So accommodation as well as the meiosis, that is constriction of the pupil, is done by the sphincter pupillae muscle, and they are controlled, or they are the function of parasympathetic nervous system. And these fibers are coming from where, sir? All the way from your Edinger-Westphal nucleus, which is actually a part of your third nerve. Makes sense. So you can even mention there, these are nothing but your short ciliary nerves. Short ciliary nerves, guys. So therefore, this is the entire course of the third nerve, and even the supply of the third nerve, even along with the parasympathetic component, has been completed in the easiest manner possible. That is the best way to learn, guys. Now after completing this entire topic over here of third nerve, let us see some important MCQs which has been tested in the previous exams and all, guys. Please add a note there. Note number 1. The first thing that you have to know, which I have already said you like in the very beginning, guys, oculomotor nerve, the third nerve exits out between which two arteries? So third nerve exits between the posterior cerebral artery, that is your PCA, and superior cerebellar artery. Be very careful, it is not cerebral, it is superior cerebellar artery. That point has been already asked in your exam, take care about that. So third nerve exits between the posterior cerebral artery and superior cerebellar artery. Next, one more point to make a note here is that third nerve, it is the nerve which is most commonly involved in intracranial aneurysm, guys. The reason being, it is in very much close proximity with the circle of Willis. I hope you have heard about that Berry aneurysm and all. Yes. So third nerve is in very close proximity with the circle of Willis. That's the reason why most commonly involved in the intracranial aneurysm. So most commonly involved in intracranial aneurysm. So out of all your cranial nerves, the cranial nerves which is most commonly involved in aneurysm is third nerve. And now we'll come to one more important MCQ. So in this manner, I'm trying to cover like all the MCQs which has been tested in your exam. So let us discuss about one more important MCQ, and that too one of the important clinical application of this one, guys. So try to understand very clearly. I said you that suppose if this is your third nerve nucleus, the third nerve nucleus on either side will be merged. It's not like a separate nucleus, it is merged on both the sides. Now what is the importance of this one? The fibers which are coming from the nucleus on one side will cross over onto the other side, and they are the one which will be going and supplying to superior rectus muscle. Then the fibers from the other side will be again crossing and then will be supplying to the superior rectus muscle on the other side. Hope you are understanding here. So it's all about the superior rectus muscle now. Superior rectus muscle on both the sides are not supplied by the ipsilateral fibers or ipsilateral nerve. So the fibers are crossing inside the nucleus itself, and then they are actually supplying to the muscle on the other side, guys, contralateral side. Now what is the importance of this one? Now the importance of this one is, suppose if there is injury of cranial nerve number 3. I am not telling the nucleus, guys, be careful with that one. I'm not telling oculomotor nerve nucleus, I'm telling oculomotor nerve itself. So, if there is an injury to oculomotor nerve, then what will happen? Will there be paralysis of lateral superior rectus or contralateral one, or both of them? That is what we have to find out here. So, now if there is an injury to third nerve, actually, be very careful with that word, oculomotor nerve, not nucleus guys, injury to oculomotor nerve. Then what will happen? It will lead to the paralysis of ipsilateral superior rectus. It will lead to the paralysis of what guys? Ipsilateral, the superior rectus muscle on the same side. No confusion with that one. If there is an injury to nerve. Now what will happen if there is an injury to the nucleus then? Let me just mark here. If this nucleus is involved on this side. So you can clearly appreciate, my dear friends, if there is an involvement of the nucleus, then the fibers which are going to the ipsilateral superior rectus, they are also involved. And obviously the fibers will be which are going to the superior rectus muscle on the other side, they are originating from here only. So both the fibers are involved there. That's the reason why there will be paralysis of bilateral superior rectus. That's important. So second condition here, if there is an injury to third nerve nucleus, oculomotor nucleus. If there is injury to oculomotor nucleus, then what will happen? It will actually lead to paralysis of bilateral superior rectus guys. Bilateral superior rectus. That's the importance of that nucleus which is like combined there, and it has been already tested in the exam. So that's the reason why I told you in the very beginning, I'll show you one of the clinical application of this one. I repeat again for the last time guys, if the only nerve is involved, if the nerve is involved, ipsilateral superior rectus will be paralyzed. If the nucleus is involved, then bilateral superior rectus will be actually paralyzed. So that is the importance of third nerve here. So these are all the MCQs that has been tested in your exam guys. So we have completed the entire third nerve, the course of that, the supply of that, with some important MCQs that has been tested in the exam. That's all about the third nerve. Now let us move towards the next nerve here guys, next cranial nerve. Now moving on to the next cranial nerve here guys, let's begin with the fourth cranial nerve, that's your trochlear nerve. Let's discuss everything regarding the trochlear nerve. Now even in the trochlear nerve, we'll do the same, we'll actually study in the same manner guys. First of all, let us make the platform ready. Let's see the entire course from where all the trochlear nerve passes. So again the same thing, we all know very well, the fourth nerve will also begin from the midbrain only. So this will be the transverse section of the midbrain with that grey matter present here, substantia nigra, and the duct in the center will be the aqueduct of Sylvius surrounded by that grey matter here. Sir. And now when we are learning about the trochlear nerve, the fourth nerve, something important here guys. We have to take the transverse section at which level? This is the transverse section of midbrain at the level of inferior colliculus. So on the dorsal aspect, remember we are actually having the inferior colliculi this time, sir. Now after exiting from here, the fourth nerve, again the same thing, even that is also going to pass through cavernous sinus only. But is it passing through inside the cavernous sinus? No sir, it will be actually passing through the lateral wall of cavernous sinus. Lateral wall of the cavernous sinus. Then after passing through the lateral wall of the cavernous sinus, again the same thing, even fourth nerve will also pass through superior orbital fissure. This will be the superior orbital fissure. Fine. And then inside the orbit, eyeball, an eyeball surrounded by those extraocular muscles. And you all remember the formula very well, SO4, LR6 and rest all by 3. I'm like wantedly making you write down that so that you're not confused over there guys. SO4, LR6, rest all by 3. So out of all the extraocular muscle, the superior oblique is the one which will be taken care by fourth nerve, sir, the trochlear nerve. Fourth nerve, that is your trochlear nerve, sir. Fine. So this is the entire platform ready here from where all it is going to pass, and we have discussed everything in the previous topics. The cavernous sinus in detail, all the cranial foramen, superior orbital fissure, everything in detail. So that's why I'm telling you always again and again guys, you have to first of all follow all the topics in the same sequence. Then only the cranial nerves will become easy guys. Now let's start with the fourth nerve and let's see something really important here. The fourth nerve nucleus will be separated apart. So it is not like combined like the third nerve nucleus, they are separate. Now something important regarding the fourth nerve is that after beginning from the midbrain, it's not having the ventral origin, it is actually having the dorsal origin. In fact, it is the only cranial nerve which has got the dorsal origin. So the fourth nerve will be actually coming from here and then exiting out from here like this. Okay, and then the fourth nerve from this nucleus will begin and exit out from here. Now, the second point which I am trying to make you understand here, guys, it's not only having the dorsal origin, it is even actually crossing. And in neuroanatomy, we know crossing is actually known as decussation. And remember, the decussation is actually taking place inside the midbrain itself. That is why it is known as the internal decussation. It's not decussating after coming out. Try to understand that. It's actually decussating inside the midbrain only, guys. Okay. Try to appreciate that in my diagram here. So there are two important things, dorsal origin as well as internal decussation. Now after coming out, again the same thing, it's easy. The fourth nerve will be going through the lateral wall of the cavernous sinus, and after passing through the lateral wall of the cavernous sinus, the fourth nerve will enter via the superior orbital fissure, supplying to the superior obliques. That's all. It's easy here. Understanding? So the important thing is all about the midbrain wala part. So that is the only thing where we have some important points to make a note of. Otherwise, the remaining thing is very much easier. The fourth nerve is going through the lateral wall of cavernous sinus, going through the superior orbital fissure, and then supplying to the superior oblique muscle. So again, the same thing we'll do, guys. After completing this topic here, let us write down all the points which are very much important regarding the fourth nerve. Point number 1. It is the only cranial nerve which has got dorsal origin. Remaining all the cranial nerves we have seen in brainstem has got like ventral origin. Only cranial nerve having the dorsal origin is the fourth nerve. Number 2, second thing here, it is the one which has got internal decussation. Internal decussation, guys. So fourth nerve is the one which is actually crossing, decussating, that to inside. The fibers are crossing inside the midbrain only. So therefore internal decussation. And third thing, remember, it is actually the thinnest cranial nerve. Out of all the 12 pairs of cranial nerve, it is the thinnest. And in one of your exams recently, they have given the word not as thinnest, guys, it is given as slender most nerve, which is like most slender most nerve, nothing but thinnest only. Next one. And one more thing that you have to remember, it is also a smallest cranial nerve. So all this terminology has been asked in the exam, guys. You have to be careful with like longest and shortest, largest and smallest, thickest and thinnest. Okay. So hope I am not confusing you. The thinnest cranial nerve, fourth nerve, and the smallest cranial nerve is also the fourth nerve, not the shortest, smallest. Shortest is actually lengthwise, and smallest and largest will be size wise. Okay. So smallest is the fourth nerve. And one more important point that you have to remember, the fourth nerve has got the longest intracranial course. It is the nerve which has got the longest intracranial course, inside the cranium traveling the longest intracranial course. So these are all the important points to be remembered regarding the fourth nerve. And in this diagram, I hope the entire course as well as the supply has been made very much easier to remember, guys. So that completes regarding your fourth cranial nerve. Now as we have planned, first of all we are going to complete the third and the fourth and the sixth nerve, because they are the one which are taking care of your extraocular muscles over here. So let us first of all now complete the sixth nerve. Then later on we will study about the fifth one. So now the sixth cranial nerve, abducens nerve. Now this time I think you are able to recall from neuroanatomy. This time the origin will differ here. Third and the fourth nerve are originating from the midbrain, whereas the sixth nerve, the nucleus of the sixth nerve will be actually present in pons. And I hope you remember that it is going to exit out from that pontomedullary junction. The sixth, seventh and eighth will exit out from the pontomedullary junction. But the nucleus will be present in the pons, guys. Okay. So let us first of all again do the same thing. We will learn all the cranial nerves in the same manner. Let's first of all draw the diagram or make the platform ready here, guys. So this time you just imagine this one is your pons here. I am just drawing a schematic diagram here. Pons. Inside the pons you will be having the sixth nerve nucleus. And then sixth nerve, again the same thing. It is going via the cavernous sinus. But this time be very, very careful, my dear friends. Is it going through the lateral wall of the cavernous sinus? Absolutely not. It is going inside the cavernous sinus. So sixth nerve is the one which is going inside the cavernous sinus. That is important point to make a note of. Then after that, remaining story remains the same. It is also going via the superior orbital fissure, then the sixth nerve will enter inside the orbit. Inside the orbit, you'll be having your eyeball surrounded by extraocular muscle, and we know the very famous formula SO4 LR6 rest all will be taken care by the third nerve. Now, out of this, we can very clearly see there the lateral rectus. So, lateral rectus is the one which will be supplied by the sixth nerve. It will be supplied by the sixth nerve. So, that's your platform, entire platform ready. The entire course of the sixth nerve is ready. Now, let us draw the diagram of the sixth nerve, guys. So, the nucleus of the sixth nerve will be present inside the pons only, and after coming out from there, it will be first of all moving up. I'll even show in the diagram, guys, in the transverse section here when we'll study about the cranial foramens and all. The sixth nerve is going above, or it is moving up the clivus part of that. Okay, so it is going to move up through the clivus part, and then it is going to enter inside the cavernous sinus. Then the sixth nerve will be entering to the superior orbital fissure and then going and supplying to the lateral rectus. It's very much simple here. I repeat again, the sixth nerve, the nucleus will be present in pons, exiting out from the pontomedullary junction, passing through or inside the cavernous sinus, then through the superior orbital fissure, finally supplies the lateral rectus. It's very simple. Now, one important MCQ that you have to remember here, you'll be actually having, imagine this one here to be the apex of the petrous part of temporal bone. So, this is the apex of petrous part of temporal bone. Now, if that is the apex of the petrous part of the temporal bone, that is in very much close proximity with the sphenoid bone, and there you will be actually having a ligamentous canal. That ligament is between the petrous part of the temporal bone and the sphenoid bone. So, it is like petrosphenoidal ligament will be there. Now, that much in depth is not required here. I want you all to remember one thing very clearly, apex of the petrous part of temporal bone and then the ligament there, and because of that ligament there is a formation of canal, and that canal is actually referred to as Dorello's canal. So, there will be a ligamentous canal here, and that canal is referred to as the Dorello's canal here, sir. So, which nerve is actually the one which is passing through the Dorello's canal? It is your sixth nerve, that is your abducens nerve. Abducens nerve is going to pass through Dorello's canal. Now, what is Dorello's canal? Nothing but a ligamentous canal near the apex of the petrous part of temporal bone, guys. That is all about the sixth nerve that you have to remember. Now, after completing the normal course as well as the supply, now let us see certain important MCQs regarding the sixth nerve. Add a note there. Note number 1. Abducens nerve is the one which is having longest intradural course. Don't get confused here. When we learn about the fourth nerve, trochlear nerve, it is actually having longest intracranial course, whereas sixth nerve will be having the longest intradural course inside the dura mater, traveling the longest inside the dura mater. And second point that you have to remember regarding the sixth nerve, it is most commonly involved in increased intracranial pressure. So, generalized increased intracranial pressure, when there is like a complete increase in the intracranial pressure, the most common cranial nerve to be involved will be your sixth nerve, and this question has been asked a lot of time in the NEET PG exam as well as the FMG exam and all. So, you have to remember this point, guys. Sixth nerve is most commonly involved in generalized increased intracranial pressure, and it is the one having the longest intradural course. So, therefore, finally, this diagram makes everything easier. The diagram on the screen there makes it easier to learn about the sixth nerve, the course of that and supply. And by this, we have completed the third, the fourth and the sixth nerve, and together they are the one which are taking care of extraocular muscles, guys. SO4, LR6 rest all by 3, and these 3 cranial nerves are done, and now we'll move towards another cranial nerves. Done. Thank you.